Every 66 seconds, another senior in this country is told they have dementia. By the time this video ends, 20 more families will hear those words. And for some of them, the cause isn't aging, but a bottle sitting in their medicine cabinet that they were promised was safe. After this video, you will know the 9 medications most closely linked to rapid memory loss. Pay close attention to number 3. This drug is prescribed to millions of seniors for a reason that sounds completely harmless, and it could be shrinking the memory centers in your brain right now without any warning signs. Let's start with number 9. And don't let its position at the bottom of the list fool you, because this medication is in almost every medicine cabinet in America. Number 9 is diphenhydramine. Pharmacies usually call it Benadryl. It's that little pink pill that people often take to fall asleep, soothe allergies, or relieve cold symptoms. It only costs a few dollars, is sold right over the counter, and most people assume that since it doesn't require a prescription, it must be gentle. But inside the brain, it works in a completely different way. Benadryl belongs to a class of drugs called anticholinergics. That's a long word for a simple concept. They block a chemical in the brain called acetylcholine. Acetylcholine is the messenger the brain uses to form new memories and stay sharp throughout the day. As we age, our brains produce less of this chemical and have to rely much more on what is left. So, a drug that blocks it will hit the brain of a 70-year-old much harder than that of a 30-year-old. But here's the part that gets hit the hardest: the hippocampus, a small seahorse-shaped structure where new memories are formed before they get stored. In my practice, I have seen many patients take antihistamines every single night for years and slowly lose their edge, yet they never connect that mental fatigue to the pink pill sitting on their nightstand. In addition, after digging into studies from 2023 in the Journal of Senior Cognitive Health, researchers tracked older adults who regularly used anticholinergics and found a 54% higher risk of developing dementia compared to those who didn't. That is over 1.5 times the normal risk for a pill that most of us treat like candy. So, here's what you need to do. Read the labels carefully on any sleep aids and anything marked PM, nighttime, or allergy relief, because they are very often just Benadryl under a different name. If you take it for allergies, there are newer antihistamines like loratadine, sold as Claritin, which don't cross into the brain like Benadryl does and are much safer in the long run. Never stop taking a medication on your own. Take your pills to your doctor, but don't assume that just because a drug is over the counter, it is safe for your memory. That was number 9. Number 8 is a drug your stomach loves, but your brain quietly pays the price for: proton pump inhibitors. Well-known names are omeprazole, sold as Prilosec, and esomeprazole, sold as Nexium. These medications suppress acid production in the stomach and are prescribed for heartburn, reflux, and that burning sensation after meals. People take them for years, sometimes decades, because as soon as they stop, their symptoms roar back. So, it feels like the medication is the only thing keeping it under control. Here's the part almost no one hears at the pharmacy counter. Your stomach needs acid to absorb certain nutrients from your food, and most importantly, vitamin B12, which protects your nervous system and brain. If acid levels drop too low for too long, your vitamin B12 levels will slowly deplete. The same goes for magnesium and calcium, two minerals that brain cells need to fire and signal properly. If your brain cells are starved of those nutrients, you start getting misfiring, confusion, and memory lapses that look exactly like the early stages of Alzheimer's, when the real culprit is just a nutrient your drug has been blocking all along. In 2016, a major study in the journal JAMA Neurology looked at over 73,000 people aged 75 and older. Those who regularly used proton pump inhibitors had a 44% higher risk of dementia than those who didn't. And it is not just about nutrients, because proton pump inhibitors have also been shown to increase levels of amyloid beta in the brain, which is the sticky protein that builds up in Alzheimer's. So, here's the solution. If you take a PPI every day, talk to your doctor. Many people can slowly taper off and switch to a milder class of drugs called H2 blockers, like famotidine, sold as Pepcid, which are far less likely to affect your brain function. Chewing deglycyrrhizinated licorice, a natural compound that coats and soothes the stomach lining, can relieve symptoms without doing any harm to your brain. The goal is to use the lowest dose for the shortest time possible, not to take a pill forever out of habit. Medication number 7 is prescribed for a problem most people don't want to talk about. The seventh drug is for bladder control, and the name to know is oxybutynin, sold under the brand name Ditropon. This is given to seniors when they get that sudden, urgent need to go. It's the kind of overactive bladder that can disrupt your entire day. The relief it brings is real, and the embarrassment it helps you avoid is real too. But oxybutynin works by blocking acetylcholine, the very same memory-making chemical that Benadryl blocks. And this drug easily crosses into the brain, building up right where memories are made. That makes it one of the more dangerous drugs on this list for older adults, especially when used month after month, year after year. In 2019, the British Medical Journal published a study on people over 65 who used strong anticholinergic drugs like oxybutynin for more than a year. Their risk of dementia was 49% higher, nearly a 50% increase. And what worries me most is that almost none of them were warned. They were just told that the pill would quiet their bladder. Nobody mentioned that it might dim their memory at the same time. This is usually blamed on old age. People describe forgetting appointments, losing their keys 10 times a day, or losing their train of thought in a simple conversation. And everyone around them just nods and says, "Well, you are getting older." Rarely does anyone trace it back to their prescription pad until the damage is already done. If you are taking oxybutynin and have noticed your memory slipping, take it seriously, because you do not have to choose between your bladder and your brain. Newer drugs like mirabegron, sold as Mirbatric, work through a completely different pathway and do not block acetylcholine at all. For most older adults, they offer similar control with far less risk to your memory. Be sure to bring this up at your next appointment. Number 6 might be the most surprising one on here because it is one of the most widely prescribed medications in the world. Number 6 is statins. Simvastatin and atorvastatin, sold as Zocor and Lipitor, are among the most heavily prescribed drugs on the planet, especially after age 60, and they play a critical role in lowering cholesterol and reducing the risk of heart attacks and strokes. Statins are a part of life for many people, and this is not an argument against them. But here is the other half of the story that often gets left out. Cholesterol isn't just about your heart. Your brain is actually nearly 60% fat, and it uses cholesterol to build the myelin sheath, the insulation that wraps around every nerve so signals can travel fast and sharp. If you drive your cholesterol down too aggressively with statins, your brain can starve of the raw materials it needs. The statins that cause the most trouble are the ones that easily cross into brain tissue. In 2023, a study in the journal Frontiers in Aging Neuroscience found that adults over 70 who had been on statins for more than 3 years had a 26% higher rate of mild cognitive impairment, and the higher the dose, the worse the decline. Some patients describe scary blank spots. A familiar name vanishes. A conversation that just ended is wiped clean. A route they have driven for 20 years suddenly feels completely foreign. What is key to understand is that not all statins affect the brain the same way. Pravastatin and rosuvastatin do not cross into brain tissue as easily and are generally considered safer choices for cognitive function. So, if you have been on a statin for years and start noticing symptoms like fatigue, forgetfulness, or confusion, that is when you want to talk to your doctor about lowering your dose or switching medications. It is not a reason to quietly stop a drug that might be protecting your heart. Make a proper plan with professional help, and never do it on your own. Drug number 5 is benzodiazepines, lorazepam, sold as Ativan, diazepam, sold as Valium, and alprazolam, sold as Xanax. These are some of the most heavily prescribed medications in the United States for anxiety and insomnia. They work by boosting GABA, your brain's natural calming signal, which helps quiet down an overactive nervous system. At first, they feel like a lifesaver. Panic attacks melt away, racing thoughts stop, and sleep finally comes. But over time, things change. A 2022 study in the British Medical Journal tracked more than 8,000 older adults over 6 years and found that those who used benzodiazepines for longer than 3 months had a 51% higher risk of developing Alzheimer's disease. Long-acting drugs like diazepam are even more dangerous because they stay in the body for a long time and build up in fatty tissues, including the brain. This medication gradually puts the entire brain under a chemical sedation. The brain becomes slower to learn new things and less flexible. Many people describe a feeling of emptiness, as if they are moving through a fog, no longer feeling like themselves. The cruelest part is trying to quit. If you stop taking benzodiazepines suddenly, anxiety and insomnia can rush back twice as strong, along with severe agitation that can actually be dangerous. This makes the pill feel essential at the exact moment it is doing the most harm. So, here is the rule, and it is incredibly important. If you have been taking benzodiazepines for more than a few weeks, do not stop suddenly, because doing so can be life-threatening. Work with your doctor to slowly taper off over weeks or months. There are gentler options like buspirone for anxiety, which does not cause drowsiness or brain fog, and specialized cognitive behavioral therapy for insomnia and anxiety, which helps restore calm without harming your mental sharpness. All right. The fourth medication is a single pill prescribed for 3 different issues, and it carries one of the biggest hidden risks. This fourth drug is amitriptyline, sold under the brand name Elavil. It is an older antidepressant that is still used today to treat nerve pain, insomnia, and even to prevent migraines. And that very versatility is why it has quietly spread so far. This pill looks like a cure-all, but inside, it is one of the strongest anticholinergic drugs still in widespread use, meaning it powerfully blocks acetylcholine. That is the exact chemical your nerve cells need to talk to each other and form new memories. It blocks it so strongly that with long-term use, memory issues are no longer just a rare side effect. They become an expected result. In 2015, a major study in the journal JAMA Internal Medicine tracked more than 3,400 adults aged 65 and older. Those who took the highest cumulative doses of anticholinergic drugs like amitriptyline over 10 years had a 54% higher risk of developing dementia. And almost none of them were ever told that the drug could cause that side effect. They took it to sleep or manage pain, and then slowly noticed they were forgetting words. Their memory was slipping, and their focus was fading, and they just blamed it on getting older. That is incredibly dangerous. It does not even take a high dose. A small dose every night for years can quietly drain brain function without any obvious symptoms until the decline becomes all too real. If you or a loved one are taking amitriptyline, this is something that needs to be discussed soon. For nerve pain, options like duloxetine or gabapentin can offer similar relief without the heavy anticholinergic load. For sleep, melatonin or very low-dose doxepin, which has a much smaller impact on this chemical, can be good alternatives. And to improve mood, newer antidepressants like sertraline or escitalopram are considered much safer for long-term brain health. Now, the third medication is the one I warned you to be careful with because it is prescribed to millions of people for reasons that sound completely harmless. Third on our list is paroxetine, sold under the brand name Paxil. This is one of the most widely prescribed SSRI antidepressants, used to treat depression and anxiety. At first glance, it looks like a modern, gentle choice, far softer than older psychiatric medications, but here is the detail that is rarely mentioned. Paroxetine is the only SSRI with strong anticholinergic activity. That is what sets paroxetine apart from similar drugs like sertraline and escitalopram, because it hits the very same acetylcholine system that all the other drugs on this list are targeting. In 2021, a major review in the journal Frontiers in Psychiatry looked at older adults using various SSRI medications and found that those taking paroxetine showed a significant decline in short-term memory, word recall, and focus within the first 12 months. Older adults taking paroxetine were 30% more likely to show early signs of cognitive decline compared to those on other antidepressants. It is deeply ironic because the medication is meant to stabilize the mind, but over time, it can erode the very mental clarity it was supposed to protect. The solution here is clear. In older adults, paroxetine should be avoided. The American Geriatric Society lists it on the Beers criteria, an official registry of medications considered potentially inappropriate for older people, and paroxetine is on that list for these exact reasons. If you are taking this medication, ask your doctor about switching to a safer SSRI, like sertraline or escitalopram, which are gentler and do not carry the same risk of cognitive decline. Adding B-complex vitamins, especially B12 and B6, can help support mood naturally alongside these changes. The second type of medication is prescribed so quietly that many people taking it have no idea what it actually is. These are antipsychotics, and this is what worries me the most, because so many people on them never consented to taking an antipsychotic. The names of these drugs are quetiapine, sold as Seroquel, risperidone, sold as Risperdal, and olanzapine, sold as Zyprexa. They were created and approved to treat severe mental illnesses like schizophrenia and bipolar disorder. Today, they are often prescribed off-label to older adults to help with sleep, mild restlessness, and the agitation that can come with dementia. Powerful medications meant for severe illnesses are now being used at home and in nursing homes for seniors who are simply confused, restless, or difficult to manage for busy staff. The cost is devastating. In 2022, a study in Lancet Healthy Longevity tracked more than 25,000 older adults and found that those given antipsychotics for behavioral symptoms had a 71% higher risk of severe cognitive decline within a year, even with no prior history of dementia. These drugs also raise the risk of stroke, sudden cardiac death, and cause heavy sedation that leads to falls and hospitalizations. They work by blocking dopamine, a chemical involved not just in mood, but in focus, planning, and memory. When dopamine drops too low, the brain becomes sluggish and unresponsive, which is why people on these drugs can seem listless, indifferent, and almost emotionless, leaving their families to grieve for a loved one who is still physically there. If you or a family member are taking one of these medications, the first step is to ask the prescribing doctor directly. Why was this prescribed, and is it truly necessary, or is it just for convenience? Most behavioral symptoms can be managed without drugs by keeping a predictable daily routine, reducing noise and overstimulation, treating underlying pain, and adjusting lighting and sleep habits. When medication is absolutely necessary, using the lowest dose for the shortest possible time helps minimize the harm. Often, no one tells families how these medications affect the brain, so they watch a decline they believe is just from aging, when the real cause is chemical. The number one cause isn't a single medication, and it might be the biggest hidden factor behind all the stories I just shared. The number one danger is using multiple anticholinergic drugs at the same time. This is a danger almost no one talks about, yet it might be one of the leading causes of drug-induced memory loss in older adults. You might be waiting for one final, worst of all pill. But the real worst-case scenario is more subtle. It is the slow, cumulative effect of taking multiple anticholinergic medications at once without anyone calculating the total dose. Polypharmacy simply means taking multiple medications at the same time, and the anticholinergic burden is the combined weight of all those drugs working together to block a memory-regulating chemical. Picture a very common scenario. An older adult takes Benadryl every night for sleep, oxybutynin every day for bladder issues, and amitriptyline to manage nerve pain. Each individual drug might only cause a tiny, almost unnoticeable slip, But when combined, they amplify each other, and the total burden on the brain climbs rapidly. In 2022, a study in the journal Age and Aging tracked more than 280,000 older adults and found that those with the highest anticholinergic burden had a 120% higher risk of developing dementia within 10 years, more than double the risk. And the vast majority of them had absolutely no idea they were even taking anticholinergic drugs. No one had ever explained it to them. When you block acetylcholine from multiple directions at once, the brain does not just slow down. Neurons actually begin to shrink from disuse, connections wither, and the brain enters a low-energy state that looks almost identical to Alzheimer's disease on a scan. But here's the hopeful part, and it is the exact reason why I am making this video. This medication-induced decline is often reversible if we catch it early. Once you lift that burden, many people regain their mental clarity, energy, and memory within just a few weeks or months. The brain is far more resilient than we think, but only if you stop giving it what is hurting it. Fixing this does not require a miracle. It just takes a closer look at what you are taking. Sit down with your doctor or pharmacist and ask them to go over every single prescription, over-the-counter medication, and supplement you take to calculate your total anticholinergic burden. There are simple scoring tools designed to do exactly that. Once you identify the culprit medications, you can slowly taper off the ones you do not need, switch to safer alternatives, and give your brain the time it needs to heal. Take care, and I will see you in the next video.